Well, helping to save lives and serve our country and our community at the same time, if that sounds something like you would be interested in knowing more about, you're in luck today. I want you to listen up. Joining us this morning is Staff Sergeant Alexis Michelle Eddings. She is an Army healthcare recruiter with details about a virtual career fair coming up. I'm sure you guys have been doing a lot of virtual stuff lately. First of all, Staff Sergeant, I want to thank you for your service to our country.
Thank you so much, ma'am, and I appreciate you having me here.
Absolutely. Excited to learn more about, first of all, let's talk about the Army Reserve Healthcare Team. Tell us about that.
So the Army Reserve Healthcare Team comprises of something like 100 areas of concentration, everywhere from doctors to nurses, support staff, as well as what else do we have? Veterinarians. We have everything on our Army healthcare team.
Really? Veterinarians? I guess that's under the healthcare category. It just happens to be for animals. That makes sense. So what are some of the reasons people are coming in and deciding to join the Army Reserve Healthcare Team?
First and foremost, I believe it's service to country. There's a lot of pride behind that, as well as adventure, continuing education. The Army Reserves has a lot of educational benefits as well as training. And I think some people like to bring that education and training and those lessons back to their community within their civilian healthcare teams.
Absolutely. And thank goodness for that. What about qualifications? Are there any prerequisites? Are there any type of special people that you're looking for?
Right now, we have a big search out for some nurses, as well as medical students who have recently graduated. Maybe you're currently in your residency. And like I said, there's over 100 AOCs that we're constantly searching for. I always say, don't disqualify yourself. Come and speak to a recruiter.
Oh, excellent. You know what? That's a good thing to say because there's all different types of needs out there. Let's talk about benefits, and especially an Army Reserve versus going into civilian practice.
Some of the benefits are first of all, it's going to be your peer group. Your peer group is going to be nationwide instead of located within your hospital or within your city. There's continuing education, such as different fellowships and residencies you're able to get into, as well as a lot of leadership training, which is something that is crucial in the healthcare system to be a strong leader, not just a doctor, not just a nurse, but understand how to lead.
Yeah. Yeah, that's
And
really
then we have those humanitarian missions and different things that are going to teach you a different type of skill set.
wow. Gosh, this sounds so fascinating. And a lot of healthcare professionals who are already working as a civilian are choosing to join the Army Reserve. Why is that?
I believe it's just bridging the gap for them. It's in a different way to give back to their community. We have a ton of benefits for student loan repayment. It's a second income. It's an additional retirement.
Oh.
So I believe those are some of the reasons.
Yeah, those are all really, really good reasons, actually. How can people find out? It sounds so much fun and so interesting and challenging. How can somebody decide if it's right for them?
Well, we do have local recruiters located in almost every major city. But with this certain event, they can go and register at bit.ly/service to community. We're doing this massive service to community career health fair. And it's going to be a virtual one, so everyone's invited. It's March 27th, 11 a.m. to 3 p.m. Pacific Standard Time.
Excellent. Really good information, Staff Sergeant Alexis Michelle Eddings joining us this morning. We appreciate you for that. I want to give our viewers a bit more information. If you would like to know more about joining the Army Reserve Healthcare Team, you can call this number 602-253-0371 or visit ArmyMedicalCareers.Today.